And so we've been operating as one of the authorities of Kalamazoo, of the county of Kalamazoo. So I want to welcome all of you and celebrate the groundbreaking for this construction of the integrated services of Kalamazoo First Behavioral Health Urgent Care and Access Center. This is not a medical access center. This is a behavioral health. Now, when I say behavioral health, we're talking about services for people with mental health problems and also people with substance use disorder problems as well. Well, before I make a few remarks and pass this along to staff, I just want to recognize our board of directors. Can you come forward and just be recognized? I'm not going to call all of you out, but I guess maybe I will. Michael Seals is our vice chair. Pat Gunther was a former chair. Just raise your hand, Pat. The Kinga Bergen, who is on our board, but she's also with the best community college in the whole world called Kalamazoo Community College. All right. We also have, I said Pat Gunther. We have Commissioner Veronica McKissick. Thank you, Veronica, for doing this. Melissa Woolsley, she's new, and she is very vocal, so we're happy to have her as part of our board. And then, of course, we have Karen Longnecker, who is the chair of our board, and she'll be part of this celebration as well. I don't think I left out anybody, did I? If I do, just holler and scream at me. But I want to just extend our appreciation to all of our providers. I'm not going to name all of you. I hear all your names, but then you change faces. So all of our providers, please raise your hand and be recognized, because this is a wonderful day. All of our service providers, thank you. And then we have staff. Actually, we have close to 400 staff, but I said, nah, we don't want to fill this parking lot up, but we have staff members. Why don't you just raise your hand and be recognized today, all of our staff that's here. I also want to extend appreciation for our community partners who are also in attendance today. And I think I see, I don't know, is Bill Mann's here, President and CEO of, okay, Terry, you're here, see here, and also Kurt. So Bronson Healthcare Group, please raise your hand. You counted, thank you. We have Dr. Tom Roth, who is the new CEO and President of Ascensions, Michigan, Southwest Michigan. Dr. Paul Tumulin, the wonderful relationship and partnership that we have with Deputy Med, and we're really progressing. You know, Kalamazoo is very fortunate to have a medical school, and I just want to announce that here. And I think it needs to get more credit than what it does, because it really is helping us. It's helping our service delivery system, particularly the Department of Psychiatry. Anna Lingerville, Anna, I think I saw you, okay, from Gene Marker. I don't know if, who else, other folks that I have, I'm going to get there in just a minute. I don't know if we have, I don't think Grace, I know that Grace Luana was going to be here. I don't know if she's here. But I also want to have our partners with public safety. And I'm not going to name all of you, but I see somebody who actually trained me over the last 2 Saturdays in our Citizens Academy. It is a wonderful, wonderful academy, and I encourage all of you to participate in it. So raise your hand, all of the officers that participated in there. And in addition to that, our Protect and Connect Council members, please raise your hands. Yes, please raise your hands. They're here. It's just a wonderful collaboration that we have with public safety. And our sheriff is here, our wonderful sheriff, Rick Fuller. Sheriff, raise your hand. I'm also going to recognize our state representative, Julie Rogers. State Senator Sean McCann is here. And then representing our Senator, Debbie Stabenow, who pioneered and led and is leading Certified Community Behavioral Health, Mary Judnick. Thank you, Mary, for coming from Grand Rapids for this event. I want to give special recognition. Oh, I see our KVCC partners out there. Raise your hand back there, KVCC. I can't leave them out. But I want to give a special thanks to our county administrator, Kevin Caitlin, and also Mary Balkema, that really went to bat for us. So please be recognized. You can't, I can't express just how much I appreciate the help that you guys to make this happen. Our 24-hour behavioral health urgent care center, we expect it to open in June 2023, and I certainly hope that will happen. And I'm going to really bear down on our partners, Dykema Hammond, that's here, please raise your hands. And I don't know if we have Millie Davis, our construction manager, so they're there, and they'll be part of the celebration as well. Originally, we had planned, and folks was asking me earlier, well, you know, what is that building over there? I think Al Jones asked me that. I said, well, that's actually us. He said, well, who's us? Well, it's part of, this is our 4th location in Kalamazoo, so we've grown enormously. But our youth and family division is in that building. We also have services for people with persons with intellectual and developmental disabilities. Our training unit is located there. And that is one of the first buildings that we actually inherited from the county when the county spun us off in 1997. And it used to be, for people as old as I am, it used to be the old health department. Who remembers that? Oh, there's people as old as I am that remembers that. It used to be the old health department. So folks were asking, well, I thought it was going to be part of that building. It was going to be part of that building. And we ran into some construction problems. Consumer Power had a line that was going down Cooley Street. So we just said, well, maybe we ought to just look at other options. Other options was to put it on the other end of the building. But then we said, staff came to me and said that, well, you know, this is sort of a short-term plan to just renovate our existing building and make improvements in the property. Why don't we look for years to come and plan for that strategically? And so what we decided to do is to develop a behavioral health urgent care and access center. So what in the heck is that? It is not an emergency department, so I don't want our hospital partners to shudder here. In fact, I think they're going to applaud us. We know that the state is having, statewide, there is a shortage of psychiatric beds. It's in crisis proportions. We have a waiting list, unfortunately, at one of our state hospitals right here, Kalamazoo Psychiatric Hospital, where individuals may get backed up in the emergency departments. And we struggle with that. And believe me, we don't want to have people that are backed up in emergency departments, but it occurs. But our thinking is that we have a 24-hour, 7-day-a-week urgent care and behavioral health urgent care and access center. We can attend to individuals that may not necessarily need to be in the emergency departments. This is not taking the place of the emergency department, but it is a less restrictive way that I think that we can intervene and provide services. We can observe people's conditions. We will have 24-hour professionals that are on site to screen for services. And then we would also make a decision on, do they need to go to the emergency department, or do they need to go other places? And so that's when the social determinants of health comes into our system. Some folks really need a place to go. They may need to go back home, or they may be homeless. And we know that we have a homeless issue here in Kalamazoo. So we want to attend to those issues as well. The funding of this project is $5 million. And the contributors that we got local funding for it from the County of Kalamazoo and also from the Irvin S. Gilmore Foundation. And I know that they could not be here today, and they extended their greetings to you. So I do want to applaud the County of Kalamazoo and also the Irvin S. Gilmore Foundation. What I want to do now is to just introduce our leadership staff that are in attendance, and they can give more information as to what this Behavioral Health Urgent Care Center is going to be. And we're going to have someone special that's going to really talk to you as to his vision of the Behavioral Health Urgent Care Center. So we have our wonderful mayor, David Anderson. David, where are you? Everybody knows David. David is our senior executive for Housing Recovery Center and Facilities Management. And David has been here longer than I have, and I've been here for 21 years. Diane Schaefer is our senior executive for Policy Planning and Innovation. Beth Ann Mites is our administrator for the Certified Community Behavioral Health Clinic and Adult Behavioral Health Services. And then Sheila Hibbs is our administrator for systems, performance, and programs. And then who's going to speak and going to be introduced formally is going to be Courtney Jennings, who's our community health worker. But I'm going to ask Beth Ann Mites to come forward and introduce Courtney.
So I promise I'll be really quick here, you guys. I got to talk into it. I talk really loud. So, all right. So a lot of people ask, what is the Certified Behavioral Health Clinic? And really what that did for us in Kalamazoo is it gave us additional funding so that we could really expand our access. So we're really hoping to see the access hours expand and more people get connected to services. The other thing that funding really did for us was allowed us to address more urgent care needs that we see in our community. It helped us to better expand our partnership with the law enforcement agencies, with our current contract partners, and with our schools and just other community partners so we could really get people connected. One of the other areas that was really a large area for me and close to my heart was that we were able to bring in community health workers, and we were beginning to be able to identify social determinants of health needs that were interfering in people getting connected to services. And it wasn't a service we could have before because we didn't have funding that would support something like that. So when I think about the CCBHC, what it really means to Kalamazoo community is that we can really expand our opportunity for people to engage in services. So I'm really proud to introduce one of our community health workers, and we're going to have community health workers located at our behavioral health urgent care and access center so we can get people connected right away. So Courtney Jennings, if you can come up and talk a little bit about your role.
Thank you. My name is Courtney Jennings, and I am a community health worker here at Integrated Services of Kalamazoo. What we do as community health workers, we serve as liaisons for our individuals served. And we specialize in connecting these individuals with social determinants of health, also, which include housing, food, clothing, insurance, things of that nature, and it continues to grow and expand as we continue to grow the program. Our goal as community health workers is to provide support and help alleviate some of the concerns and stressors that may be affecting one's quality of life. We do not have all the answers. However, we strive to help find solutions as we work diligently with our providers. So if you know someone that has some stressors that needs some assistance, please look for us and we can possibly assist them. Thank you. Here's Diane.
I'm going to now ask, she's here, Diane Schaefer and David, take it away.
Thank you, Jeff. Thank you, Courtney, for telling us a little bit about your role. That's something that's certainly very exciting for us at ISK. One of the other things that you've heard a little bit about today that we are very excited about is we've been working over the past few years on really strengthening our partnership with our public safety and law enforcement communities, because we know that we serve many individuals who cross both of those systems. So one of the other opportunities that this Urgent Care and Access Center provides us is to work more closely with emergency services and public safety to provide an urgent care center where people can get more quickly connected with services. It will hopefully reduce the burden on some of our more restrictive settings like emergency departments and jail. And by working with public safety to develop some kind of protocols for who is the right person to bring to an urgent care versus an emergency department will allow that person to have crisis services more readily available to them, trauma-informed care, and hopefully culturally responsive services that will help with the connection to ongoing mental health or substance use services. So we are working with all of our county law enforcement agencies, which is really exciting. And we're making a lot of headway in being able to serve the individuals better in our community. So I'm going to pass things off to Jeff again.
Thank you, Diane. I just saw somebody that walked in. I want to, Bill Mann, CEO of Bronson Healthcare Group. Bill, thank you for that. And Danny Alexander. I saw you back there, Danny, from KVCC, so I want to make sure that you were recognized. Mayor, you want to take over?
Thank you, Jeff. So I am here because I am Director of Facilities here at Integrated Service of Kalamazoo. So first thing, I don't want anyone to look and think this is how this site's going to be run. It is going to be hazard-free. So this is the last day we're going to have cords where people can trip. And also, from here going forward, you won't be able to walk through that gate without wearing a hard hat. So enjoy it. This is the last moment for that. So I just wanted to talk a little bit about the building and just walk through this a little bit. Jeff has referred to it, but how does something like this happen? I mean, any project starts with a dream, an idea. And there's a lot of dreams and a lot of ideas out there. But what does it take to get to this point? You have to have some funding for it, or it will stay a dream. And I want to say, Jeff, thank you. He has led the grant-seeking team here, working weekends. I'm sure Margaret can attest to that, getting grants in on time to help fund this. Once you have the funding, you've got to take that idea and you've got to turn it into something that you're going to create. Deacon Mahaman has done that work with us for months now, putting together our dreams into something that can be built. And now someone's got to build it. Miller Davis is going to do that for us. So we got builders on site too. We've got folks who make sure we do it right. We've got city code officials who have been walking along the way. At the end of the day, we're here for a groundbreaking for a building. And our dream is that this building will be a building that feels safe and feels like a sanctuary. And staff will feel safe working here. And public safety officers will feel safe and welcome bringing people here to this building. That's the building. And we're doing the best job we can to have it be a safe and welcoming building. But once the building is built, how this all happens is people. And at the end of the day, that's what we do. We're building a building and we're recognizing that, and there's going to be bricks and steel and glass and beautiful attributes and safe components, but at the end of the day, there's going to be real people who care about engaging with folks who need services in a location that we intentionally chose to be high profile and available and to push what we intend for people to recognize as the public mental health provider, that we need to destigmatize mental health services. We're not hiding this building somewhere. Mental health services are just as critical and important for quality of life for any of us as physical health. And that is our commitment, and that is the good work we're going to be doing in this wonderful building. So from me, thank you so much for being here. I know Jeff will thank you again, but it's an honor to be part of this work. So thank you very much.
Well, again, I wanted to thank everyone for coming. We're going to have our groundbreaking ceremony. Guys, where do we go from here?